Hello there, welcome to the second episode of Putting Dr. G on the Spot in the month of June when we're talking about pediatric urological condition, and on this occasion we're talking about a condition called hypospadias. Hypospadias is a condition that is characterized by the opening of the penis pointing downwards. That itself is not an issue, but it comes with three other characteristics of hypospadias, which is quite troublesome. First of all, the opening points downwards, and that will result in a second problem called chordee. Chordee is a condition when the penis is bent downwards as well. And lastly, because it's bent downwards, the actual natural formation of the foreskin is impaired, and that will create a hooded foreskin. So the three characteristics of hypospadias are chordee, downwards pointing urethral meatus, and also hooded foreskin. For vast majority of this condition, it happens in 1 in 300 children. Actually, it's quite mild, so it's hardly noticeable. However, when it's severe, it can cause a lot of problems, such as urination downwards that actually result in wetting of the pants and resulting in smells in children. And in addition of that, it will also cause a bending of the penis and subsequently might result in some fertility or sexual function problems. So correction of the chordee itself is actually doable and quite important. So why is hypospadias happening? In fact, there are many theories to suggest that there is an increase in the prevalence of hypospadias is because of exposure of estrogen by mother during the pregnancy. The exposure of estrogen can occur in various forms. It can appear in food or environment, and that itself actually makes the androgenizations of a boy less of an issue, and then therefore the feminizations occurs. And when that happens, the penis itself is impaired in the form of chordee. There are various operations that actually can be used in order to bring forward the actual opening and also straighten the penis and the circumcision to remove that chordee. So it depends on how severe the actual hypospadias it is. The repair itself may or may not be necessary. So during the baby check for the newborns, the nurses always get alert when the penis itself is pointing downwards a little bit, and with close examination, if hypospadias occur, then it may be corrected when the child becomes slightly older, for 1 or 2 years old. And the correction itself, make sure the penis is straight, and subsequently the child will have a normal sexual and reproductive life. For the following week, I'm sure many parents want to find out, there's a condition called micropenis. So exactly what constitutes micropenis? Stay tuned for next week's Putting Dr. G on the Spot.